Hello student, in this demonstration we will see about the cervical vertebrae, which is the last bone on the head and neck. We already have seen the skull, mandible, so the one part is left, it is the cervical vertebrae. Now cervical vertebrae, have you identified the cervical vertebrae? It is the very easy to identify the cervical vertebrae. If you can see, this is the two cervical vertebrae. Now here you can see this is the foramen, right? Foramen is in the transverse process. So this is the name of this foramen is foramen transversarum, which is present in the transverse process, which is a typical feature of the cervical vertebrae. So you can identify by cervical vertebrae by presence of foramen transversarum in the transverse process, which is not present in the thoracic vertebrae. So you identify the cervical vertebrae by the foramen transversarum in the transverse process. You identify the thoracic vertebrae by the presence of the articular facet on the transverse process on the body also, and if both is absent, it is a lumbar vertebrae, and by the size also you can identify the lumbar vertebrae, because in the exam the all vertebrae are the together is put in one table in a hard part. So you have to identify the all vertebrae or whatever the vertebrae given to you to identify. Okay, now cervical vertebrae, also we have the typical and the atypical cervical vertebrae. Number 3 to 6. Number 3 to 6, it is a typical cervical vertebrae, because we know the typical cervical vertebrae means they bear the common feature. It is a typical. And the atypical cervical vertebrae, it is a number 1, 2 and the 7, which we can identify by their special features. So these all are the atypical cervical vertebrae, and this is the typical cervical vertebrae. So let's first see the typical cervical vertebrae. Okay, so this is a typical cervical vertebrae. Yes. Now this part is a body. Now common part, all you know which are the common parts in the vertebrae, right? Body, then pedicle, this is lamina and transverse process. This is known as spinous process, superior articular facet and the inferior articular facet. So first we see how the bodies look like. This is the body of the typical cervical vertebrae, and you can see the body, it is a elongated transversely. So it is a oblong transversely, then antero-posterior. So it is elongated transversely, then antero-posterior. It is one of the feature. By the shape also you can identify the shape of the body. You can identify the cervical vertebrae. If you see the shape of the body of the typical thoracic, it is a heart in the shape, and lumbar vertebrae as it is already a massive. So it is elongated transversely, then antero-posteriorly. Then this is now the main part is how you identify the superior surface of the body and the inferior surface of the body. To see, now this is the transverse. Now the shape of the superior surface of the body, it is a concave. Here you can see this is the concave in the shape. On lateral side, it is a projecting upward. Right, lateral side, it is a projecting upward. So this is the superior surface. If we see the inferior surface, now this inferior surface, it is a saddle in the shape. Okay, it is a saddle in the shape. Now it is a convex side to side and concave antero-posteriorly. But here you can see the lateral border, it is a beveled, because it is articulate with the upward projecting of the superior surface of the below vertebrae. But their anterior margin, it is a slightly go downward. If you can see like this body, yes, you can see the body. Yes, if you see the superior surface, the lateral part is projecting upward, and if you see the inferior surface, the anterior part is projecting downward. Okay, so by this you can identify the superior surface and the inferior surface of the body, and by this also you can identify the superior surface and the inferior surface of the vertebrae. Okay, so this is the body. we have seen. Behind the body, this is a vertebral foramina. If you see the shape of the vertebral foramina, it is a triangular in the shape, and the size of the vertebral foramina, it is a larger than the body. Okay, next part, this is a pedicle, which is a going backward and laterally. This is the lamina, which is a going backward and medially. Where the lamina and pedicle meet, here there is a superior articular facet. So this is the superior articular facet, which is a projecting backward and upward. Now if you see on this side, this is the inferior articular facet, which is a projecting downward and forward. Now by here you can see, okay, yes. Now this is a superior articular facet, which is a projecting backward and upward, and over here it is a inferior articular facet, which is a projecting downward and forward. Okay, and this is a spinous process. Now typical feature in a spinous process, it is a bifid at a tip. This is also another typical cervical vertebrae. So you can see this is the how a typical bifid spinous process is present over here, right? So it is a bifid spinous process present in the typical cervical vertebrae. Now the important part is left is transverse process. Okay, now in a transverse process, the important feature which we have is this is the foramen transversarum, by which the transverse process is divided into two parts. This is known as anterior root, this is known as posterior root, right? Anterior root, and behind the foramen transversarum is a posterior root. If we go laterally, this anterior and the posterior root is end in the tubercle. So this is known as the anterior tubercle, this is known as posterior tubercle, right? So this is a foramen transversarum, and in front of the foramen transversarum, anterior root, behind it posterior root, and lateral to the anterior root, anterior tubercle, lateral to the posterior root, posterior tubercle. Now in each vertebrae we have a costal element and the vertebral element. Now in the thorax we have the rib proper. So the rib is a costal element which is separated in the thoracic region. But what happens in the cervical region? See, this is the anterior root. Now see, one more thing is anterior root and the posterior root is connected by this structure. This structure is known as it is a transverse bar. Right? It is a costotransverse bar which is a connect the anterior and the posterior root. So it is the anterior root, anterior tubercle, costotransverse bar, and posterior tubercle. So this all structure, it is a represent the costal element. Costal element means it is like a rib in the thorax, but in the cervical region there is no rib, so it is not developed. But this part, it is embryologically developed from the costal element. When you see the development of the rib, you will better understand. Right? Anterior root, anterior tubercle, costotransverse bar, and posterior tubercle. It represent the costal element, and posterior root, it is represent the vertebral element proper. Okay, so this is the feature of the typical cervical vertebrae. Now important attachment is on the anterior surface of the body at upper and the lower border both, there is an anterior longitudinal ligament. On the posterior surface of the body, it is a posterior longitudinal ligament. On the lamina, it is a ligamentum flava. On the spine, in this again in bifid part also, ligamentum nuchae. On anterior anterior tubercle, scalenus anterior, and posterior tubercle, scalenus medius and scalenus posterior. I am only taking the important attachment. I am not going in the detail of the attachment of the muscle, right? So anterior longitudinal ligament anterior to the body, posterior longitudinal ligament on the posterior surface of the body, ligamentum nuchae at a spinous process tip, ligamentum flava on the lamina. This is the common for the all vertebrae. Only anterior tubercle, scalenus anterior, and posterior tubercle, scalenus medius and the posterior. So this is all for the typical cervical vertebrae, which we can identify by foramen transversarum in a transverse process, bifid spine, and transversely elongated body, and laterally it is a projecting upward on a superior surface.